Hi there, my name is Sarah, and I'm here today with iHealthBrokers. We help our clients nationwide to understand their health insurance options and enroll in the best possible plan. We assist our clients with marketplace plans, which includes healthcare.gov, all different types of Medicare plans, vision, dental, and private insurance, which includes short-term medical plans. You should know that you have many different options in your quest for health insurance. You can, of course, contact the carrier directly. That's the insurance company, and speak with an agent. However, an agent will only be able to present you with their company's plans, so you will have to make multiple different phone calls in order to compare. This can be a little bit difficult. And you can also use healthcare.gov for marketplace plans. However, comparing different health insurance plans can be a little bit confusing, which is why we always recommend that people work with a broker. A broker works for you, not the insurance company, which is the carrier. So a broker can present you with multiple different plans which are offered by multiple different carriers. Now, it is important to note that you will not receive any type of discount or incentive by working with an agent and a carrier directly, nor will you be charged more by working with a broker. Now, some brokers do charge an additional fee, a service fee that's charged upfront. However, many don't, and we certainly don't. So if you have any questions whatsoever, please feel free to contact us in the comments or give us a call at 888-410-0344. We're happy to answer any of your health insurance related questions. Today we're going to be talking about the projections for 2023 marketplace plans. Now, this is based on the information as we currently have it. We will make sure to update you if more information becomes available. So make sure to subscribe to stay up to date, because we do release these videos on a weekly basis. And please make sure to like this video, that way we can get this information out there. The topic of today's video is especially important, and we want to make sure that our clients and our viewers are as well informed as possible. And if you'd like, you can find us at iHealthBrokers, not only here on YouTube, but on Facebook, TikTok, Instagram, and Twitter at iHealthBrokers. Under the American Rescue Plan Act, eligibility for premium tax credits was dramatically expanded. So people that were ineligible for premium tax credits in years past suddenly became eligible. A premium tax credit is just a tax credit paid up front. This is reflected in a discounted monthly premium. Now, not only was eligibility expanded, but the size of these premium tax credits was also expanded. So many people were able to find plans for less than $10 a month. Unfortunately, these expanded premium tax credits expired in June of 2022. Now, don't worry, that doesn't mean that your premiums are going to increase right now. You're still good through the end of the year. But come 2023, it's very likely that you may see a significant premium increase. It is still possible, and possibly even likely, that the government will choose to reinstate these expanded premium tax credits for a period of time, or possibly indefinitely, but this is the information as we currently have it. If these premium tax credits do in fact expire, it's expected that the average premium will increase by 53%. It could be more or less dependent upon your circumstances, but that is the average. Now, of course, this is going to have multiple negative effects. Number one, this would drastically affect the average American's finances, and that is not to be understated. This is a significant increase. Additionally, many people will choose to opt out of health insurance entirely because it is just too expensive. And that's bad for multiple reasons, of course. It's also bad for the monthly premiums, because with this reduced pool, companies may increase their premiums further, which is actually what is expected to happen. It's been recently reported that insurance carriers are planning to increase premiums by an average of 10%. This has nothing to do with that 53% increase, which has to do with those premium tax credits. Now, of course, premiums do tend to increase on a yearly basis to account for inflation, so that's part of it. And of course, there are rising healthcare costs, which have a little bit to do with COVID, but it is largely to do with the pool of beneficiaries, which may drastically drop. But there are a few factors that could help to stabilize those marketplace plan premiums or possibly reduce them a little. First, there's Medicaid. So during the pandemic, Medicaid reassessments were frozen. Basically, in order to qualify for Medicaid, there are very strict income and asset criteria, and these are reassessed on a yearly basis. If a person's income now exceeds that threshold, they would no longer be eligible for Medicaid when they're reassessed. Because those reassessments were frozen, there are many people who would have become ineligible for Medicaid who were able to keep their Medicaid coverage. These people will now likely be looking towards marketplace plans. And if you are one of those people, it's still very likely that you will be eligible for a premium tax credit, so you may still be able to find a quality plan that is within your budget. Finally, many families have been kept out of the marketplace because of the family glitch. This is something we've reported on in other videos if you want to learn a little bit more. Basically, under the Affordable Care Act, people are ineligible for a premium tax credit if they are able to receive employer-sponsored group health insurance through their workplace, unless it is deemed unaffordable, meaning that those premiums are too high based on their income. Unfortunately, this doesn't take into consideration people's families. Very often, the monthly premiums for an individual are very reasonable and very affordable, but when adding dependents, those premiums skyrocket, and this is the family glitch. There is a proposition to fix this, hopefully within the year, and if that's the case, those families that had been unable to access premium tax credits with the marketplace could now look towards marketplace plans. Now, in all honesty, the projections are not very positive as of right now. That may change, and we will continue to update you. Regardless, there are some steps that you can take and some alternatives that you can pursue. For example, if at all possible, you'll want to lower your MAGI, which is your Modified Adjusted Gross Income. That's what healthcare.gov looks at to determine your eligibility for a premium tax credit. So, in order to lower your MAGI, you may want to work with an accountant. They're a skilled professional who can hopefully give you some tips to lower your MAGI and make you eligible for those premium tax credits. This can save you thousands of dollars per year. And of course, you'll want to work with a broker who can guide you towards the right plan. You may want to look into a high deductible health plan which has a health savings account, which is an HDHP with an HSA. Contributing to an HSA can lower your MAGI and might make you eligible for a premium tax credit if you were otherwise ineligible. There are also catastrophic coverage plans. These are available on and off the marketplace. Now, for the marketplace catastrophic plans, of course, you do need to be under 30 unless you apply for a hardship exemption, which is based on your finances. So you might be able to access a catastrophic coverage plan even if you are over 30. These will make sure that your basic needs are met and, of course, protect you should you incur major medical bills, but the premiums will be much, much lower. Similarly, there are short-term medical plans. These are a type of private insurance, so they're available off the marketplace, and they are entirely customizable. A young, healthy person could find a short-term medical plan for about $100 per month. Now, of course, the more benefits you add, the more expensive it's probably going to be, so there are certainly pros and cons to take into consideration. And remember, short-term medical plans are not available in all states, and they're not ideal for all people, but they are something you should be aware of. Finally, even if you are ineligible for Medicaid, your children may be eligible for CHIP, which is the Children's Health Insurance Program. This is part of Medicaid, so if you want to learn more about that, check out Medicaid.gov. These are certainly trying times, and we do hope to have some more positive information to share with you in the near future. But in the meantime, like I said, please make sure to subscribe to stay up to date. Also, it's best to start thinking and booking your appointments in advance. If you're someone who is going to try to lower your MAGI, you may want to meet with an accountant sooner rather than later. And of course, if you are going to work with a broker, we highly recommend that whoever your broker is, that you book an appointment now as opposed to waiting until open enrollment time. As we get closer to open enrollment, those appointment slots do tend to fill up. And remember, open enrollment begins in most states November 1st. So do try to book your appointment in advance. In the meantime, if you have any questions whatsoever, please send us a message in the comments or give us a call at 888-410-0344. We're happy to answer any and all of your health insurance questions and point you in the right direction if need be. Thank you so much. Have a wonderful day. Bye-bye.